right, hi folks, July 27th. Time to check in with Dr. Janet Memark. She's the head of Cobb and Douglas Public Health here to see how Cobb is doing with COVID these days. Dr. Memark says she sees some signs of improvement, but it's way too soon to tell if it's real.
For Cobb County, unfortunately, we passed the 10,000 case threshold. So we have over 10,000 and 151 cases right now and 287 deaths at this time. So we continue to be on our high plateau. Everybody keeps asking if this is a second wave, but we had really not come off of the first wave, and so we had come down a bit, but then we really didn't get it down to levels that we really wanted it to be, like low transmission levels. So after all the holidays and the reopening of the state, we have just had this second surge, and so it looks like it might be coming down a little bit from that high surge, but it remains high at this time.
Since the beginning, one of the big worries has been hospital beds. How many hospital beds have been taken up by patients that have COVID-19? Well, Dr. Memark runs it down.
Wellstar is obviously going to be the folks that have the most accurate picture results of the hospitalizations. But what we do know is we do have very high numbers of patients that have COVID-19 in our area hospitals, and there is a shortage of ICU beds. That being said, Wellstar is able to do some shifting if they need to, but at this time we do have low availability in ICU beds. But ventilator usage is pretty good, and we have them available, so that's good to know.
Does that send any sort of message of what's going on?
We wonder though, because the people are younger this time that are getting sick, and the Wellstar and other hospitals have done much better about treating COVID-19. So I know that they really try hard not to get people on ventilators, and they do all the other stuff ahead of time, because once you get them on, it is difficult to get them off. And so they've come a long way with the treatment of COVID-19 patients, and I think of doing a lot better with that. So that's a bright spot in all of this.
All right, and so another problem has emerged. When testing became available to everybody seemed to want to test. And that has created some rather lengthy delays on test results, which in itself is troubling.
Yeah, it's going well. So we've done almost 25,000 tests out there. The one thing I wanted everybody to know, though, is because of the scheduling system that we had, people were able to come in earlier or go to different places, and so we're having a lot of no-shows right now. So I wanted everybody to know, keep checking our website. We're adding more appointments every day, so you can get in. I know it looks like we don't have appointments for a while, but if you check every day, you can probably get an appointment the same day. So I just want to make sure everybody knew that.
How quickly do they get the results back?
Results are still taking about 5 days is what I'm seeing on our system, but I know in the state it still can be 6 to 8 days. It is concerning because we need to have those results back as quick as possible to be able to do the contact tracing and isolating and quarantining of people. And so the state is working on that. My understanding is they're trying to get a few more labs online so that we can have quicker results. But those of you watching national news know this is a national problem as well. So this is not just a Georgia problem, but the state of Georgia is working hard to get more labs online.
One thing public health's been trying to do is do more of the outreach testing. So basically going to where the people are to have them tested rather than have those people come all the way to Jim R. Miller Park here in Cobb to get tested. So the problem is those outreach testing sites have been popping up here and there rather quickly. So you've got to pay attention to see when it's near you.
Yeah, so we're really excited. So we have a new partnership with the CORE group, and so they've been doing testing this weekend. They did some testing for us in the South Cobb area, and so we are setting up different sites. So they'll be doing some expanded testing for us to go into the evening hours. So this week it looks like it'll be in the Epicenter and Word of Faith that will be doing testing. So keep checking online because you can get an appointment with them as well, and they're doing the self-nasal swab, so a little bit different. It doesn't go as deep, and so a little bit more comfortable than the nasopharyngeal swabs.
One of the big confusing things really since COVID-19 came into our lives is when do we need to self-isolate? When do we need to go into quarantine? If somebody we've come into contact tests positive for COVID, when does the clock start? It's a confusing situation that Dr. Memark says has evolved over time, and speaking of time, she's asking everybody to use the time-based method rather than the test-based method.
People that have symptoms, once you come back positive and you have symptoms, you can actually discontinue isolation after 10 days. And making sure your symptoms are getting better though. You know, some people have some very severe symptoms, so you don't want to be kind of coughing up at day 12, day 13. You don't really want to be doing that. But if your symptoms are getting better by day 10 and your fevers are gone for at least 24 hours without medicines, you can discontinue isolation. If you had no symptoms, you can discontinue isolation after 10 days after your positive test came back. And so those are great. Now, these now are more symptom and time-based strategies. You remember that test-based strategy that people have been doing, so the 2 negative tests to be released from isolation? That is no longer recommended to do that, okay? And so, and that's for regular people. So those can be positive for over 6 weeks. So that will keep you out of commission for over 6 weeks, and you're probably not symptomatic. So it's best to go with the time-based and symptom-based strategy and not the test-based. Now, some people may have to do test-based if their immune systems are not, are really suppressed, but you work with your doctors on that to guide you on that. And then the other thing is, another update is, if you've had a test within 3 months and you were positive, it's not recommended that you get another test. So I wanted to make sure everybody kind of knew that if you're positive, your test may come back positive in 3 months. So it's not recommended after 1 positive to get another test within 3 months. Now, if you, once again, are immunocompromised, that's something you talk to your doctor about to guide your therapy, because it's a little different for every person.
And another important factor when it comes to testing, if you've come into contact with someone that has turned out to be positive for COVID or know somebody who's been positive for COVID, don't just run off and get yourself tested. Watch and wait.
If you find out that your coworker comes back positive, you do not go the next day to get a test, okay? The possibility of that being positive is going to be very low. You have to, if you are within 6 feet of that person for more than 15 minutes, you have to go ahead and quarantine, right? 2 weeks that you have to be watching for your symptoms and stuff. If you really need to get a test, you can do it at day 10. It takes 2 to 14 days for the virus to incubate in your system. If you do it right away, you're only negative for that moment, and that does not release you from quarantine. If you get the test at day 10 and it's negative, well, you're still quarantined for 4 more days. It does not release you. So please don't unnecessarily get yourself tested when it's not going to help with your quarantine situation. So we had a lot of people that were getting tested and unfortunately, I know some of their managers and bosses were requiring them to do it. And so if you could please, remind them of the new symptom-based and time-based strategy, and you can show them the proof. And if you really need some confirmation or a letter from us, we can send that off, because we really don't want people to be doing the test-based strategy when it's not really helpful and keeps people out of work too long.
There's been so much confusing information about COVID out there in social media and other places that the Cobb and Douglas Public Health folks have started putting out a weekly newsletter with some of the latest information about COVID. Here's how you can get on the subscription list.
We've been doing that for a few weeks now. You can go to cobbanddouglaspublichealth.org and sign up for it. We give you a little bit of an update of how the county is doing in regards to COVID, and then it tells you about all the activities that the health department is doing related to COVID. And so if people have some stuff going on, our outreach, things like that, we put that in there. And if you have a great story to share, then let us know, and we'll be happy to share some light on there.
If there's some good news that we can bring you in this information video, it's the fact that Dr. Memark, when she's out and about, when I'm out and about, when my family's out and about, they do see more people wearing their masks out there. And she believes that is going to be the prime factor when it comes to either flattening the curve or actually sending it downward.
I don't know about you, but I was really excited. A lot of the businesses are helping to encourage the mask wearing. And for the first time in a while, I've seen a lot of people wearing masks out in stores and out and about. And I think that's going to make a huge difference. I know we want to all get back to school and we want to do our sports and things like that. But we have to get the transmission levels down so that it's safe to do everything. And so I really think that wearing masks and washing our hands and staying 6 feet or more away from each other is going to help us to bring our transmission numbers down.
All right, the last thing, it's about school starting. We all know in Cobb and Marietta, those school districts will start the school year with online learning only, virtual learning for students. Public health officials, they advise the school district, they give them the latest stats and information, but they don't make the decisions about whether or not school will be in person or not. So send your nasty grams elsewhere.
We are not the regulatory authority, and I actually don't have any power to shut down schools. I want to make sure everybody is aware of that. I've got some interesting emails and things like that, but I don't have that power. So what we do is we share our data with the schools. And so information that we get, we let them know of how the transmission rates are doing, how case investigations are doing, how hospitals are doing, and overall case counts. Those are the things that we share with our superintendents and other school leaders so that they can make the best choice that they can. And we help them in any way we can to help to try to make the schools as safe as possible. And I know that they all want to reopen the schools as soon as possible, and they're looking for different ways that they can do it safely to protect everybody. And so I want my kids to be in school as soon as possible too, and hopefully we'll be able to get there soon.